I was flying home from Miami this weekend. I've been there teaching surgeons on the anterior approach. Great weekend, good energy, good conversations. I'm exhausted, sitting in my economy seat, ready to get back to Austin. And I'm sitting there just reading, and I hear it. Is there a doctor on board? Is there any qualified medical personnel on this plane? And what does my heart do? Sinks. Right? Because this has happened to me before. I've had to divert a plane once already for a sick patient. So when I hear that announcement, there's a split second where you think, please let there be somebody else, but you already know the answer. So I get up, get out of my seat, and the flight attendant almost runs me over, telling to get out of the way, which honestly, fair enough, right? No problem. But there's some chaos going on. And so I sit down and then I circle back and see what's going on just a few seconds later. It's a 63-year-old woman, left shoulder pain. She passed out. Oxygen saturation was dropping. Thankfully, there was a nurse there. We start working through it. Vitals, assessment. She's hypertensive, high blood pressure. Looks like a cardiac event. We get an IV in, we get some aspirin in, Nitro. I go up to the cockpit and talk to the pilot. He's on with the ground medical control, and we're trying to decide, do we land or do we keep going? Initially, the ground control doctor says, let's try to keep going. Patient responds. Blood pressure comes down, she's more lucid, and then boom, she sinks. Blood pressure plummets, she doesn't look that good. At that point, I go back to the pilot and I say, this isn't gonna work. We need to get this plane on the ground, and I'm just like everybody else on the plane. I wanna go to Austin, but we're gonna have to divert. We gotta get this lady on the ground now. So we divert to New Orleans, and while we're landing, I'm now seated in the chair right in front of her. We're on the aisle, and I'm just sitting there watching her. And I glance back and I look at her and she's doing fine. I wait a few seconds, and then I glance back and she has this pulse ox on her finger. And I look at the pulse ox, 0. And I'm like, So I reach back, grab her arm, feel for her pulse. No pulse. So here we are on final, and we pull her out of her seat, throw her in the aisleway, and start doing chest compressions on the floor in the middle of the airplane while we're landing. It didn't take many. She came back. Pulse returned. We stabilized her enough to get her off the plane and into the hands of the EMS. Everybody around the plane was like, bravo, bravo, right? We land, we get her back into a chair. The EMS folks come, pull her out, take her off the plane. Excellent. And then pilots say, guess what? We need some oxygen. Can't go without oxygen. And me and the nurse used it up on this patient. So we eventually get some oxygen. And then the pilots come on and they say, guess what? We've timed out. We can't fly anymore. But we got a new crew. So the new pilots come on board and they say, hey, understand there's been an issue on the plane. We'll get you going as soon as possible. Be right back with you. A few minutes later, they come back and say, guess what? Now the flight attendants have timed out and they can't get off the plane unless you get off the plane. So the entire crew had to deplane, which meant we had to deplane, and that was a long night. Actually, I ended up getting off the plane and going to another airline and rerouting through Houston on another airline just to get home. That's not really the point. The point is this: when you choose medicine, there are no weekends. There's no off duty. There's no that's not my specialty. I'm an orthopedic surgeon. I replace hips and knees. But when someone is dying in front of you, you're a doctor first. And that's something I think people don't fully appreciate about this profession. The responsibility doesn't necessarily turn off. You don't get to clock out. You carry it with you every day, on vacation, at dinner, on an airplane at 30,000 feet. And honestly, I wouldn't have it any other way, because at the end of the day, being a doctor isn't about procedures. It's not about RVUs. It's not about titles. It's about being the person who stands up when someone says, is there a doctor on board? And this time, when we landed, the pilot came on and thanked the medical personnel. People clapped. It was really nice. But the real reward was knowing we got her to the ground alive. That's the job.